Because why are we here? Why did the system actually miss my eczema? And why was I actually being exposed to something that could actually trigger that in my diet? And so this led me to go discover, inconveniently sometimes, of investigating, follow the money. I'm that kind of guy, I'm really kind of a medical investigative kind of person. So it's not just science, it's like, why are we here, and what's going on to keep us here? And so with that in mind, we came to this. My opinion is that right now, healthcare is under assault. Insurance companies, for example, are not in the business for our health. They're in there for profits, right? Wall Street profits, stock market profits, CEOs and high administrative salary profits, medical companies, supply companies, pharmaceutical companies, even going into the food companies, right? This is all what's keeping us unhealthy. And I'll just give you an example. People say, well, gosh, shouldn't we have some kind of universal health care? Yeah, we should. I'm going to talk a little bit of politics because we can afford it. Because right now, we can't afford just our health care. Let me give you an example. If any of you have been to the hospital just for a simple pneumonia for 3 days, that's $10,000. If you have a fracture, it's about $15,000. If you have low back pain with a little disc problem, it's $18,000. If you have a little chest pain with a little bit of cardiac, maybe possible myocardial infarction or heart attack, that's $20,000. If you have even a heart valve problem, that goes up to $42,000. I haven't even talked about a gunshot wound or unfortunate car accident happening. Now, if you have cancer, the cancer early stage diagnosis up to stage 3 can be anywhere from $100,000 to $300,000. And then when we get to up to stage 4, at end stage, it can be up to $1.4 million. Okay? Now, here's the problem. Everybody has an insurance policy that we pay a premium. The average person is spending about $400 to $800 to $1,200 a month as their premium. Then they have a deductible. The deductible is how much you pay before your insurance kicks in. So the average deductible now is anywhere from $4,000 to $8,500 per person. So you have to pay your deductible, you're paying your monthly premiums before your insurance kicks in. But here's even further the kicker, is that they have something called coinsurance. So in your policy, you'll say that there's roughly a 30 to 50% coinsurance. That means you owe 30 to 50% of your hospital stay. Okay? Now, again, the number's 100,000 up to 1.4 million. That means you will owe 30% to 50% of whatever the hospital charges because there's no control of healthcare. So we cannot afford the way healthcare is going right now. And then you have to pay copays, believe it or not, right? So you have to then pay a copay when you see your doctor. You have to copay when you get your medications. You have to pay a copay with your laboratory fees and your x-rays. So the way we're looking at healthcare is not affordable. And we actually have to be looking at something, I don't want to be political, but universal healthcare is not a radical idea. If you look at all these countries here on the map, right, these are countries that we travel to on vacation. These are our trading partners. These are our allies. They all have universal coverage. Right now with my insurance company, I cannot get sick in New York because I don't get coverage. And in fact, I can't even leave Albuquerque because my insurance policy won't even cover me outside of my state. And it even limits me to, for example, 1 hospital out of the 3 hospitals, and it's the furthest one away from where I live. So I like to tell people, we have to start thinking a little bit of why we're stuck in this area because companies like to make money. Now, if you think, well, we're still the #1 country in the world and we have the best healthcare, that's absolutely wrong. Okay, so I'm here to open up your eyes. In fact, when I sit with my patients, I use this analogy a lot. It's for those of you who've ever watched the movie The Matrix, hopefully you've watched it before, old-fashioned movie. So there's a scene with Morpheus, and he's sitting there with Neo, who's Keanu Reeves, and it's the red pill, blue pill discussion, right? He gives him this opportunity. You can take the blue pill, and you can kind of go back to this world of ignorance, or you can take the red pill, and although it's uncomfortable to understand what's happening, you will actually understand and gain consciousness. With consciousness, that'll open your mind to open up to make better decisions, and hopefully that'll liberate you from the kind of these shackles that you will be kept in. And so today, what we're looking at is opening the consciousness so you understand that you're not here by default. Your disease is not by default of you making bad decisions, but predominantly it's by design. We've kept you there. Systems marketing companies have kept you where you're at, and they're keeping you where you're at. So what did this money give us? $3.8 trillion. That's with a T. $3.8 trillion is what we spent on healthcare, 17.9% of our GDP. And in fact, right now, it's projected to go up to 20% of our GDP in 2 years. $370 billion on drugs was spent. Now, with all this money, what did that get us? We are now ranked 16 at the bottom of the 16, top 16 with the bottom here, from death from all causes. So we die more from infant mortality, homicides, teen pregnancy, HIV, AIDS, drug-related deaths, obesity, diabetes, heart disease, chronic lung disease, and disability more than 16 other countries. Remember, we spent the most. We spent more than any other country combined here. We're now ranking 34 out of 35 countries in terms of life expectancy. So it didn't buy us more life. You know, a lot of people say, well, we pay for all this health care. Shouldn't we be living longer as Americans? No, in fact, this is old data because if you listened to the news 2 weeks ago, the report came out that we fell even further. And then when we look at, ranking overall, in terms of diseases A through Z, so from top of your head to the bottom of your head, and all diseases, where do we rank in the world? We're now ranking 46 out of 48 industrial nations in terms of chronic disease care. 46. So if right now, if I go to Congress right now, if I go to any kind of politician, or if I even go to somebody on the street, we're number one, we're Americans, yeah, we should be at least in the top 3 of everything. We used to be, but we're now 46 out of 48 industrial nations. And if you look at, well, who's 43, 44, or 45? We have Dominican Republic, we have Turkey, and we have Iran. So before we start throwing stones at other people and having political problems, maybe we should start fixing things at home. So I want to start off with saying what we have become through all this aspect of politics and food is we've become an inflammation nation. Right? We're not only inflamed physically, we're inflamed emotionally, we're inflamed spiritually, we're inflamed environmentally now. Right? We have fires all over the planet. So we have to look at how do we control the inflammation.